How does urodynamic testing help neurogenic bladder? Imagine trying to understand how your bladder works without opening it up. This is where urodynamic testing comes in. It is a key tool for doctors to evaluate how well the bladder and urinary sphincter are functioning, especially in cases of neurogenic bladder. Neurogenic bladder occurs when nerve damage affects bladder control, often caused by spinal cord injuries, multiple sclerosis, or other neurological conditions. During urodynamic testing, a small catheter is inserted into the bladder to fill it with a sterile fluid. The doctor measures the pressure inside the bladder as it fills and during urination. Sometimes, a second catheter is placed in the rectum to measure abdominal pressure, helping to distinguish between bladder and abdominal contributions to pressure changes. This process provides a detailed picture of how the bladder stores and empties urine, which is crucial for understanding the specific problem. One of the main benefits of urodynamic testing is identifying issues with bladder storage and emptying. It measures how much the bladder can hold, how stretchy it is, and whether the bladder muscle contracts involuntarily. This helps detect problems like urinary retention, where the bladder cannot empty properly, or overactive bladder, which causes sudden urges to urinate, and incontinence. Knowing these details allows doctors to tailor treatments to each patient's needs. Urodynamics also reveal dangerous bladder pressures that could threaten kidney health. If the bladder pressure gets too high during filling or voiding, it can cause urine to back up into the kidneys, risking damage. This is especially important in neurogenic bladder, where nerve damage can cause abnormal pressure buildup. Early detection allows for interventions to prevent long-term kidney problems. Another key role of urodynamic testing is guiding treatment choices. By understanding whether the bladder muscle is too weak, too overactive, or if the sphincter is not relaxing properly, doctors can recommend specific therapies. These might include medications to relax or calm the bladder, catheterization methods to empty the bladder safely, or surgical options if needed. The test results help create a personalized plan that improves quality of life and protects the urinary system. Monitoring changes over time is also vital. For patients with neurological conditions, repeated urodynamic tests can track how bladder function evolves and whether treatments are effective. This ongoing assessment helps adapt management strategies to changing needs and prevents complications. Finally, urodynamic testing helps distinguish the root causes of urinary symptoms. It can tell if symptoms are due to obstruction, poor muscle strength, or sphincter dysfunction. This accurate diagnosis ensures that patients receive the most appropriate and effective care, avoiding unnecessary or ineffective treatments. From a bladder health perspective, urodynamic testing provides invaluable insights that symptoms alone cannot reveal. It helps prevent serious issues like urinary tract infections, bladder damage, and even kidney failure by catching problems early. While it does not diagnose the neurological cause itself, it is essential for managing bladder functions safely and effectively. Though urodynamic testing is not used to diagnose bladder cancer, maintaining proper bladder function is important for overall bladder health. Chronic bladder issues and infections can increase the risk of bladder cancer over time, so good management and regular monitoring are key. In summary, urodynamic testing helps in understanding how the bladder and sphincter work, identifies risks to the urinary tract, guides personalized treatment plans, and monitors progress. It is a vital part of caring for people with neurogenic bladder, helping protect both bladder and kidney health through precise, evidence-based assessment. Always consult healthcare professionals for individual advice and treatment options tailored to your specific condition.